How do doctors interpret a mediastinoscopy pathology report for lung cancer? Imagine you're trying to understand how lung cancer has spread in your body. When doctors perform a mediastinoscopy, they are looking inside your chest to check the lymph nodes in the middle of your chest, called the mediastinal lymph nodes. They take small tissue samples from these nodes to see if cancer has spread there. The pathology report from this procedure is like a detailed map that guides the next steps in treatment. The report starts by telling whether cancer cells are present in the lymph nodes. If cancer is found, it confirms that the disease has spread beyond the original tumor. The report then describes what type of lung cancer cells are in the lymph nodes, such as adenocarcinoma or squamous cell carcinoma. Knowing the exact type helps doctors decide on the best treatment options. Next, the report specifies which lymph nodes are affected. It uses a staging system called the TNM system, where the N category indicates lymph node involvement. For example, N0 means no cancer in the lymph nodes, while N2 indicates cancer in the mediastinal nodes on the same side of the chest. This information helps determine how advanced the cancer is and guides treatment choices. The report may also mention if cancer cells have invaded blood vessels or lymphatic channels within the sampled tissue. This invasion suggests a higher chance of the cancer spreading further. Although mediastinoscopy mainly looks at lymph nodes, sometimes the report includes notes about the margins, which tell whether the sampled tissue is free of cancer or if there might be residual disease nearby. Doctors interpret this report to assign a stage to the lung cancer, combining it with other details like tumor size and whether cancer has spread elsewhere. If the mediastinoscopy finds cancer in the lymph nodes, it often means the disease is more advanced, and treatments like chemotherapy or radiation might be necessary instead of surgery alone. If no cancer is found, surgery might be a good option, possibly followed by additional therapy depending on other factors. The accuracy of the report depends on how much tissue was sampled. Larger samples increase the chance of detecting cancer if it is there. Sometimes, other procedures like endobronchial ultrasound-guided biopsies are used to complement mediastinoscopy. The findings from all these tests are combined to get a full picture of the disease. In essence, doctors carefully analyze the pathology report to see if the cancer has spread to the mediastinal lymph nodes, identify the type of cancer, and determine how far it has advanced. This information is vital for planning the most effective treatment plan and estimating prognosis. Remember, each person's situation is unique, so always consult with your healthcare team for personalized advice.